Welcome back, viewers and listeners of your award-winning Let's Talk America radio. Well, did you know that African Americans are more likely to die from heart disease than any other group? And in reality, worsened during the pandemic, which is why the CDC Foundation is launching the first national cardiovascular disease prevention campaign created specifically for the Black community. Now, February is both American Heart Month, as many of you know, and also African American History Month, which makes the Live to the Beat campaign launch timely for all communities, truly. Well, joining us right now to learn more about this campaign is Dr. Lisa Waddell. She's Chief Medical Officer for the CDC Foundation, and Tara Robinson, a three-time heart attack survivor and founder and CEO of the Black Heart Association. Ladies, welcome to Let's Talk America Radio.
Thank you for having us.
Thank you for having us.
Super honored to have both of you on. First, I want to turn my sights to you, Dr. Waddell. Why does the problem of cardiovascular disease especially impact African Americans?
We have a significant problem with heart disease and stroke in this country. 1 in 3 deaths in the United States is due to cardiovascular disease, and nearly half of all Black men and women suffer from some form of cardiovascular disease. We're also seeing the rates of cardiovascular deaths, people who die, rising among the younger people, particularly between the ages of 25 and 65. And African Americans are 2 times more likely to die from heart disease and stroke in this country.
Wow. Let me ask you something. For those listening to us right now, perhaps they're 35 years old. They're like, I'm in my 30s. I may not work out necessarily, but I haven't been told anything necessarily by my physician or primary care provider. Is there anything they should be asking mom and grandparents about their health or perhaps cardiovascular history within the family?
It is really important to always understand what your family history is. We know that the risk factors for cardiovascular disease are hypertension or high blood pressure. If persons have challenges with their weight, diabetes, and if there's a history of smoking. So it's important for you to understand what those risk factors are, was there a family history of heart disease in your family, and to have those conversations with your provider.
That is so key. We have a healthcare advocate that always comes on our program, and she talks about the why. And you mentioned diabetes, blood pressure, knowing those numbers, of course, dyslipidemia, the LDL, the HDL. But truly, Dr. Waddell, the why is quality of life and really sustaining life, right? I mean, I know you don't want to necessarily scare our viewers, but heart disease is a serious matter.
Absolutely. Heart disease is a serious matter. And we know from some of the survey research that we've done that people are aware of heart disease and stroke. And so that's good news. And the good news is also that because of all of the attention to health inequities, it's really an important time for us to be launching this campaign called Live to the Beat. It's an opportunity to really focus on building confidence that you can take small steps, and the small steps that you can take can really have a big impact. So this is about living and understanding, yes, what those risk factors are, but then taking action in order to really focus on quality of life.
Yeah, so key. Thank you so much for all of your medical and expertise with us here on Let's Talk America Radio. Tara, I want to turn my sights to you. While you are truly a survivor for sure, tell us more about your experience with heart disease.
My experience with heart disease started in 2013 when my symptoms showed up, left arm numbness and neck discomfort. And then a couple of months later, I found myself having 3 heart attacks on April 10th, April 11th, and April 12th of 2014. Ended up having a massive heart attack on that last, what we were calling episodes at that time, and had 99% blockage in in my left artery. I always want to say my main, but it was my left artery, and went into sudden death and came back here, and I've been an advocate and been fighting ever since. Now I'm living to the beat, actually.
Yeah, wow. For those listening, women or men, What were necessarily your symptoms when you were experiencing the heart attack? I think that's key for people to say, well, how will I know there perhaps something with my body needs addressing?
I think as people in general, we know our bodies. So when something is off, we should be on alert. My left arm was numb, my neck was bothering me, I had upper chest discomfort, I had upper back discomfort, I was hot, clammy, and felt like I needed to vomit. Those were my symptoms. But I think it's
Tara, there
important for
are,
women, I'm sorry, go ahead.
no, you can go ahead.
I was going to say, I think it's important for women to know that sometimes they won't have symptoms. So, we just have to be mindful of how we're feeling on an everyday basis.
Yeah, such a great point. Speaking of women, I wanted to say many women are working and they're working mothers, and they have partners and husbands, and they're so busy. And they say, well, I have to schedule the kids to get perhaps their COVID vaccinations or keeping up with the vaccination schedule. And they don't always address their own health concerns. And we've had so many women come on our program talking about that. Obviously, you're someone very in tune with your body, very adamant about healthcare. Do you have any advice for the woman out here saying, I've got a long schedule. I don't have time to go in and perhaps get the mammogram or the pap or get the primary care blood workup? What would you say to her?
I would say to her that prevention is better than treatment. I would say to her that there's 24 hours in a day, and it's okay to take that cape off to schedule those appointments to get to the doctor, to take care of those babies. If you don't put yourself first, you're going to run into some issues down the line, and that's what we're trying to prevent through our Live to the Beat campaign. We're trying to small steps, and small steps including yourself first. We just have to learn how to do that as women, and an hour to see the doctor out of a 24-hour day, hey, that's a small step. 1 hour out of 24 hours.
Yeah, that is so key, and self-care is critical. Thank you so much for sharing your experience, and congratulations to you. Dr. Waddell, I want to turn my sights right back to you as we begin to wrap up. I know she mentioned talking about time for yourself, an hour a day. What can our viewers do today at home to start improving their heart health?
The reason that we're launching this campaign, Live to the Beat, is so that we can try to prevent more stories like the experience of Tara. That's really frightening what happened to her, and there's so much that people can do. So taking the small steps around physical activity, maybe it's walking up the stairs, maybe it's a short walk down the block, maybe it's just doing some knee lifts at home, but just taking some small steps and getting started. Focus on the healthy fruits and vegetables, and maybe it's making a healthy smoothie with your vegetables if that's something that would get you to take in more of those. And then, as Tara mentioned, really prioritizing and taking time for yourself and making sure that you connect with your doctor to get your blood pressure checked, your cholesterol checked, your blood pressure checked. Those are small steps that one can take. And we're talking about living to the beat. So another way that you can do is move. A lot of us really enjoy music. So turn on 1 or 2 songs and just move a little bit. Walk when you're talking on the phone. The small steps really can add up and have an impact. So let's focus on living is what this campaign is all about. And visit livetothebeat.org for more information.
I love it. Thank you so much. And before we go, I did want to mention one quick thing to you, Dr. Waddell. When you talked about hypertension, you talked about dyslipidemia. Often those are called, of course, silent killers, if you will, especially blood pressure, because people don't necessarily feel them. What would you say to the gentleman listening to us, 45 years old? I feel fine, right? And my knee's not bothering me this month, so I don't need to see the physician. And you're encouraging him, of course, to go find out things that he may not necessarily feel. How important is that to connect the dots and realize that we can have something that's hidden in us, such as heart disease, that can be potentially dangerous or fatal?
It is such an important point, and prevention, as Tara mentioned, is the key. It's important to to really get that blood pressure checked. You may not be feeling anything, but that blood pressure is high and it is just beating on your blood vessels and it is damaging your heart. And before you know it, you have a much more significant issue. So take the time, get the blood pressure checked, get your cholesterol checked, visit the doctor, go to your pharmacist if you don't have a doctor, and get that blood pressure checked there. But take that small yet really important step to help yourself live longer and focus on a healthy heart.
I love it. And it's all about living longer and focusing on your heart. To two women that do an amazing work, I thank you. Tara Robinson, thank you for all that you do. And also
Thank
Dr.
you.
Lisa Waddell. Thanks for joining us here on Let's Talk America Radio. And may we all continue to put our health first.